السلام عليكم.
Walaikum salam, sir.
Walaikum assalam.
Okay, guys, today inshallah we will practice procedures. We will start by Marwan. Marwan,
Yes, sir.
okay, you have 30 seconds and 6 minutes.
Should I start?
You can start.
Okay. Good morning. I'm Dr. Marwan. May I know your name and grade? Okay. Thank you. Nice to meet you. I believe that you have something to discuss with me regarding aseptic drainage. So how much do you know so far about these topics? Okay. Anything specific you want to know? Okay. Then today I will set you learning objective. I will teach you about the aseptic drainage. I will teach you regarding indication, contraindication, complication, and how to prevent and treat the complication. And I will teach you regarding preparation of the procedure and about the post-procedure management and the advice and follow-up. Okay. And finally, we will document it. Okay. Now come to about the indication. So when we do the ascetic fluid, if patient have a abdominal distension with history of cirrhosis of liver and confirmation of the ascites. Okay, you understand what I'm saying? All right. And what's about the contraindication? You cannot do the aseptic drainage if there is any infection at the site of the drainage, if any surgical abdomen or any distended bowel. Okay. And there is some complication when you do the aseptic drainage, like hematoma at the site of the procedure and introduction of the infection. The patient might go into the hypovolemia and might be persistent lack of aseptic fluid from the drain side. Okay, how you prevent the complication? During the procedure, there is a we can do under the guidance of the ultrasound, so that should that might be prevent your complication. Okay, and I understand what I'm saying. Okay, I will take initially you have to take consent from the patient before doing the procedure, and you have to prepare the patient by examining the patient and check the vitals and examine the tummy, okay, to see whether there is any shifting dullness or not. Then open IV cannula as you are drain the ascetic fluid. Patient might have hypovolemia. In this case, you need fluid or albumin. Okay, now you position the patient in a supine position. Then you have to prepare the equipment like gloves, draping, provident iodine, and lidocaine, and antidote as a interlipid. Okay, and a pigtail tube and bag and drain and empty syringe. Okay, so we move to procedure. Before that, you have to make a landmark like the needle insertion site should be if in the midline 2 to 3 centimeter below the umbilicus, and if in the lateral side you have 2 to 4 centimeters superior medial to anterior superior iliac spine. Okay, after identifying the landmark, you have to drape the area and give the local anesthetic agent lidocaine superficially and deep, 3 milligram per kg. and you have to wait for 5 minutes to anesthetize the area. Okay, and you do the procedure, insert directly to the picture with a needle in a zigzag technique. I think you know about the zigzag technique. And then avoid this technique is done to avoid the leakage, okay, of the fluid. Then after aspiration of the fluid, when fluid is come, then you have to connect with a three-way tape and then connect with the back drainage. Okay, keep an eye that patient so vital signs should be normal. If any time patient in hypotension, you have to start the fluid and also albumin. Okay, then after getting the fluid, you have to collect the sample in a container and send for cytology, culture, microbiology, and other study, microbiology study. Okay, then you have to check the success by checking vital sign, examination of the abdomen, and check the comfortability of the patient. Okay, how do you understand what I'm saying so far? Okay, after complete the procedure, you have to dispose the equipments and you have to document all the procedure notes and keep patient in hospitalization for 24 hours. Are you understand what I'm saying? Okay, thank you. If let's recap that we are discussed about the aspiration aesthetic fluid. Okay, so we are discussed about the indication, contraindication, complication, and how to prevent the complication. And we already teach you regarding the pre-procedure preparation and equipments, how to doing this procedure with aseptic precaution, and how we prevent the leakage by doing the zigzag manner. And then after collection of the fluid, you have to send for the cytology and for the microbiology also. Okay, and then after completing the procedure, you have to document all the thing, and definitely you have to advise the patient after checking the vitals to observe for at least 24 hours. And later, if you have any other queries, I can give you the website and other links. You can teach more regarding aesthetic drainage. Okay, hope you understand. Hope you will learn a lot from today, and next time we will discuss about any other topics. Thank you. Do you have anything else you need to know?
Yes, excellent.
I'm here.
Your time done.
Thank you.
Okay, well done. I think you did very well. You recapped also. So in this station, aesthetic drainage, it's not common, but helpful for general approach also for other stations.
Yes, sir.
Well done. So here the same general approach, introduction. After that, I believe you have some rubber. Nice to meet you. Then I believe you have something to discuss with me regarding blah blah blah. Nice topic. How much do you know so far? So you should ask two questions. You did well. The first question, how much do you know so far about this topic? The second open question, anything specific you want to know? Then you will set learning objectives. Today I will set learning objectives for you. Today I will teach you and mention the topic. I will teach you indication, blah, 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 blah. So you divide the station into 3 parts, before, during, and after. Well done. So I think you covered all the point. Here is a pie chart, teaching procedure. Teaching procedure. Okay. So the landmarks, as you mentioned, you can prepare equipment. I think you did well.
Thank you, sir.
So I will give you 10 out of 10. Next one,
Thank you, sir.
Fatima.
Hello, sir.
Yes, you have 30 seconds and 6 minutes.
Shall I start, sir?
Okay, can I start?
Good morning. I'm Dr. Safarna, ED Registrar. May I know your name and age, please? sorry, level 3. Nice to meet you. I guess you have something to discuss with me today. Yeah, the lumbar puncture is a great topic and it is very important in ED practice. So how far do you know about lumbar puncture? Do you have any specific area to discuss today? Okay, so let me teach you let me set you the learning objective. First, I will talk about the indication, contraindication, complications, and how to prevent them. And then I will teach you the technique, how to prepare the equipment, and after that, post procedure, how to manage the patient. Okay, so let's move on to the topic. So before that, if you have any queries, you can ask me anytime, and you follow me how I say. So first, I will talk about the indication. So lumbar puncture is done for therapeutic purposes, where we in AD practice we do it to see the opening pressure of the CSF fluid. Also, it is done to do the diagnose like Guillain-Barré syndrome. We can see the protein levels and also cell count of the CSF. So this is contraindicated in patients who have increased intracranial pressure and where there is any infection at the site of the insertion of the needle. And also this is contraindicated in patients where there is any history of coagulation. And talk about the complication. The most common complication of after lumbar puncture is post-procedure headache, and they can get nausea, vomiting. This is because of the needle insertion, and there is some gap causing a damage to the dura, so patient gets headache. So we should mainly concern about how to prevent this post-procedural headache. So we can to prevent this post-procedure headache, we can use small needle and with which is called pencil spinal needle. So this will prevent post-procedural headache. Also, while inserting the needle, there is a thing called stylet. I will show you the equipment. So if we keep the stylet inside while inserting, so the patient will not get headache. So I will move on to the procedure. Before that, we have to landmark the area. It is done in between L4 and L5. So it is marked in the posterior, the level of the iliac crest. It is when you join the two sides of the iliac crest. The line will join at the L4 L5 level. So between the spinous process, we can insert the needle. So now let me show you the equipment. Before that, let me show you the equipment. We need cleaning solution like iodine, spinal needle. It has local anesthetic, spinal needle, and manometry component, which is used for measuring the opening pressure of the CSF, sterile drape, sterile gauze, and universal containers. There are 4 containers which is used to take samples for cytology, biochemistry, culture, also and glucose level in the CSF, and also the procedural tray, and also the sterile dressing. So first, I will show you how to position the patient. So patient is positioned in the left lateral decubitus position, and ask the patient to curve his back towards you, and he ask the head, bend the head and flex the hip, and the knee is kept in knee chest posture. So from this position, you will get a clear exposure to the insertion area, that is L4, L5 level. So, after the questioning, we should wash our hands and wear PPE, and after that, we anesthetize the area, and before that, we clean the area and drape it, and after that, we give my local anesthesia to the area after marking the landmark, and we will wait for the anesthesia to work up and take the spinal needle with the stilet inside, and we insert it. You will feel 2 times popping sound when you prick the supraspinatus ligament. Sorry. And there are 2 ligaments in the insertion site, which is the ligamentum flavor and the supraspinous process ligament. So when you insert the needle, when they go inside, when it crossing inside, it will cause popping feeling. So while inserting, you have to withdraw see the stilet and withdraw the needle and see whether there is any CSF inside. So when the needle inside the subarachnoid space, you will see the CFS is in the stilet. So we can remove the needle and connect the needle to the manometer. So manometer is used to measure the CSF opening pressure. So it is kept in the level of the needle, spinous needle it is kept. So we have to keep it in the level and we can measure the manometer pressure. So it is better to apply the manometer with the connecting tube. So we can there is a 3-way tap. So we can while measuring, inserting, while keeping it, you can collect the samples
Thank you,
also.
Fatima. Thank you. Your time
Sorry.
done. Thank you. Your time done.
Okay.
Okay, well done. Anyway, in the exam, you will find further 2 minutes. So try to mention the most relevant points. Try to concise your approach. Okay. So you did well. You divided the session into 3 parts, and also you follow the general approach, introductions into questions, then divided the session into 3 parts. So the most important here, you will mention the position of the patient. These are the most important points to cover. The position of the patient, okay, and also the direction of the needle. You will insert the needle, don't remove the stylet, okay. Here you have landmarks, mention whatever L3, L4, or L4, L5. Okay. You will mention the layers, which layers they will puncture. Okay. And here you have a spinal needle and the stylet. So you will insert together. The type of needle, better also to mention. So you have this one pencil point. This is the most important because this with low risk to cause post-lumbar headache, post-lumbar puncture headache. Okay, so once you insert, you will find the CSF fluid flow. So you will measure, you will connect it to a nanometer, and you will measure the pressure. What is the normal pressure, guys?
20 centimeters. 12 to 18, sir.
12 to
10 to 20, sir.
It's a different.
12 to 18.
It's different from source to source. Sometimes 8 to 18 or 10 to 20. Anyway, it's in the same range. Okay. So the nanometer should be in the same level of the puncture side. Okay. After that, you will take 8 drops for 5 tubes. 8 drops for glucose, 8 drops for microscopy, 8 drops for biochemistry for protein, and 8 drops for microbiology for gram stain, and 8 drops for xanthochromia. And this one should be covered with 5. Okay. These are the steps you can mention by concise way. Clear, Fatima?
Yes.
So just you can take a screenshot. So just mention step 1, step 2, step 3, step 4, and so on. I think it's very concise in one slide. Okay. Okay. You did not end your task, so I will give you 8 out of 10. But you did well. Thank you.
Okay, thank you.
Tamil?
Yes, sir.
Okay. This is station procedural sedation. Very, very common. Okay. So acidic drainage, not common. Lumbar puncture, not common. But procedural sedation, very common. And you can expect it in the next exam as well. Okay. So procedural sedation, two approaches. And I mean two tasks. So the examiner can give you as teaching, like that, or he will ask you to take consent. Clear?
Okay, sir.
Samodo?
Yes, sir.
Okay. You will do this station, but without teaching. Okay? So your Tamil, your task, teaching and the practical skills in the pie chart, and in the task, teaches a junior doctor or teaches a nurse, anything. Okay?
Okay, sir.
For Samodo, your task, take consent from the patient, not teaching. Okay?
Okay, sir.
So the difference between two stations with Tamil, because you will teach the nurse, you can talk in medical terms. But Sumodo, try to avoid medical terms because you will take consent from the patient. Okay? So you will divide the station into three parts. Both of you, Tamil and Sumodo, you will divide the station into three parts. Okay? For the nurse, you will follow the general approach of teaching. Introduction, rapport, and after that, two questions, and then divide the station into three parts. Okay? For the patient, you will do introduction, rapport, empathy, because how can I help you? I have shoulder problem. Clear Samodo?
Yes, sir.
Oh, sorry to hear that. Are you comfortable? Do you have any pain? And so on. So you should cover anything like history taking in the beginning, and then you will tell him, I am here to do procedure which is called blah 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 because you have blah 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 blah. Okay, so you covered already the indication. Some examiners, they are annoyed if you mention for the patient indication, contraindication, complication, and so on. Clear?
Okay.
How to avoid this point? Not all examiners. How to avoid this point? So you no need to mention the word indication. So you can mention the indication without mentioning the word itself. Okay, like what? You can say, I need to do procedure, which is called procedural sedation, because you have shoulder dislocation and it needs reduction to be normal, and it's very painful. For this reason, I need to give you sedation. So already you talk about the indication without mentioning the word indication. Clear?
Okay.
Contraindication, for the nurse, you can mention indication, contraindication, blah, blah. For the patient, you can say about contraindication, it means ample history, it means a lemon assessment, it means the ASA classification, right? So for
Okay.
the nurse, you will say to check the contraindication, you have to assess the ample history, lemon assessment, and ASA classification, and no need to mention the details for the nurse. Okay, but for the patient, you can ask him directly. You can tell him any allergy, any past medical disease. If you want to ask the patient and show the examiner why you are asking this one, so for example, you can say, I want to take some data from you to see if you have any contraindication. This is logic also. Okay. So you can ask him, do you have any allergy, any past medical disease, any blah 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 blah. Cover the point of ample history. And lemon assessment with the nurse no need to do. And you no need to teach her about lemon assessment. But for the patient, you have to assess lemon. So you will ask the patient, I need to examine your airway to see if you have any uh, difficult airway. Okay. So you will ask him, I'm looking from external and blah blah blah. So you will follow lemon, clear? L,
Okay.
it means the look externally. And E, evaluate. So you will evaluate 332. So you just pretend in the exam, you will ask the patient, can you open your mouth? I will evaluate 332. No need to do, just verbalize, clear? And even if the patient is not um, responding and not opening his mouth, no problem. Already you can pretend, okay? What else regarding M, Malambati? Can you open your mouth? I will assess Malambati score. And after that, O. What is O?
Obstruction.
Okay, so
Obstruction.
yes, you will verbalize. I will check for any obstruction, for any abscess, and then N, neck mobility. Can you rotate your neck to left to right? I will check for any neck problem in neck mobility. So you are showing the examiner that you are checking lemon assessment. Okay? I wish it's clear. Okay. Then you will verbalize to the examiner, I will assess as a classification by past medical diseases. Okay. Then you will go for complications. Okay. With the nurse, you will verbalize to her it has some complication like blah 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 blah. Like for example, the patient will go in deep sedation. So how to verbalize to the patient? You can tell him um, it can cause some complication, like you can go in deep sedation, and in such a case, we need to insert a tube into your lungs or into your mouth or into your airway. Okay. So how to avoid that? For the nurse, easy to verbalize to her, and for the patient, you can tell him, we will keep you and monitor the area, and then you will talk about preparation. So preparation here means the preparation of the patient, preparation um, of the doctor, preparation of the equipment, okay? And then you will discuss about the minimum staff in the preparation, patient on oxygen, patient on fluid inserted to IV access, and then you will give medication. You will discuss about medications. For the patient, you can ask the nurse. Of course, you don't have nurse in the station, but just verbalize, please nurse prepare medications of sedation and mention the names and the doses. Easy, Somodo?
Okay, sir.
For the nurse, it's very easy because everything medical term, no problem. Okay. So after that, you will give the sedation and then you will wait for 4 hours. The patient has no symptoms. No symptoms like what? The patient has pain. I mean shoulder dislocation. And you should check the pain after the procedure. What else? You give the patient sedation, and this sedation can affect the respiration. So the patient has no problem regarding respiration. So you will observe regarding two important points, pain and respiration. So you can observe the patient after 4 hours, sorry, and this should be without symptoms, especially pain and breathing. Okay. Then The patient will not sign for 24 hours, not drive for 24 hours, and the charge was third party if it is normal. Okay. So Tamil, you will do
Yes,
this
sir.
with practical skills teaching, okay?
Okay, sir.
You have 30 seconds and 6 minutes. You can start.
Okay, sir. Good evening. I'm Dr. Tamil. I'm the ED registrar. May I know your name and level, please? Nice to meet you. I believe that you have something to discuss with me today. Is it right? Okay, fantastic. It's a procedure sedation is an important practical skill in ER. So how much do you know so far about procedural sedation? Is there anything specific that you want to learn? Okay, so Dr. Sami, I will set a learning objective. So I will teach you the indications, the contraindications of procedure sedation, complications, and how to treat and prevent the complications, the techniques, okay, and then how to prepare, before the technique, how to prepare ourselves as a doctor, and how to prepare the patient. And then finally, the post-procedure management and follow-up and documentation, and also the assessment of success of the procedure. At the end of the session, I will give you a good website and videos to guide you more in teaching the procedure sedation, okay? So for the indications of procedure sedation is a short duration, if it's done for short duration painful procedures in emergency setting, for example, for reduction of fractures like a Colles fracture or mid forearm fractures, or if there's any dislocation, and also for suturing of a simple wounds and wound exploration and debridement, incision and drainage for any superficial abscess, or if we're planning to cardio for any patient. And contraindications of procedure sedations is the procedures that patient need to go for operation theatre, or when there is a high anesthetic risk or difficult airway and the patient has not been fasted. And also for children less than 1 year of age, and when there is an inadequate staff monitoring and unfamiliar drugs. Procedure sedation complications are that patients sometimes can go into deeper sedation, which subsequently can lead to respiratory arrest, or when there is an inadequate sedation, hypoxia or hypercarbia, or when there's an airway obstruction due to secretions, loss of airway tone or laryngospasm, and vomiting and aspiration could also be a complication, and failure of the procedure. So for the preparation of the patient, so we need to explain the indication, contraindications, and the complication, and we need to get the consent from the patient. And also for difficult airway, we need to do a Lemon assessment and ASA classification. And then for the once we get the consent, we need to prepare medications. We need to prepare medications according to the patient's weight. So we can prepare an intravenous midazolam 0.1 milligram per kg and intravenous fentanyl 1 microgram per kg. And also we need to prepare, prior to the procedure, we need to prepare airway equipments and connect the patient to all the monitors such as blood pressure, ECG monitoring, pulse oximetry, and end-tidal CO2. And we need to connect the patient on a high-flow oxygen, get the 2 IV intravenous lines, and prepare intravenous fluids. Once we have done all this, we need to check the X-ray, make sure which side there's a dislocation, check the name, and then once we have injected the medication, once we've connected the patient on the monitors, and then we can inject the medications. And once we have injected the medication for the shoulder reduction, we need to get the patient to lie in a supine position with arm adducted and the elbow flexed in the 90 degrees. And then we need to provide an external rotation till you can feel a resistance. And then you need to adduct the shoulder and flex it in an external rotation. And throughout the procedure, we make sure the vital signs are stable. And then at the end of the procedure, we need to continue to monitor the patient for the next 4 hours in the recovery room. And then we need to repeat the examination, especially the respiratory examination, make sure patient is not in respiratory distress. And we need to repeat an X-ray post-procedure. And then we need to, and then once if the reduction is successful, we can put the patient on a arm sling or collar and cuff, and then discharge the patient once the patient is fully conscious and the vital signs has returned to normal, and patient has no pain, nausea, vomiting, or breathing problems. And make sure we discharge the patient, advise the patient that the patient won't be able to drive for the next 24 hours, and discharge the patient with a third party. And then after that, we need to dispose the PP, wash our hands, and we make sure we document all our procedures and the steps we have done in our collecting sheet. So, Dr. Sami, do you have any questions so far? Is there any steps that you want me to repeat? Okay, so let me recap whatever I've just explained to you. So for the procedure sedation and shoulder reduction technique, you need to know the indication, the contraindication, the complication, and how to treat and prevent the complication. And we should always make sure we need to assess the patient's airway by doing a Lemon assessment and ASA classification. And we make sure to get the consent from the patient for the procedure. Once the consent is done, make sure we prepare the medications and make sure we prepare the medications based on the patient's weight, and we make sure we calculate the dose accordingly. And then we need to prepare the IV equipments, and also we need to connect the patients to the monitors and prepare high flow oxygen to IV lines and the fluids. And then once we have given the medications, we can do the shoulder reduction technique as I've mentioned earlier. And then post-procedure, we continue to monitor the patient in the recovery room, and then repeat the examination and
Thank
repeat
you.
the X-ray.
Thank
Thank
you.
you, sir.
Okay, perfect. Well done. So I think you covered almost all the points. The most important in such a case, you will follow the general approach of teaching, because they said here teaching and practical skills. Then, because it's a procedure, you have to cover the station 3 parts: before, during, after. Already you covered all the points: indication, contraindication, complication, how to avoid that, and the preparation. You cover the medication. Did you cover the minimum stuff?
I didn't, sir.
Okay, so minimum stuff should be 3 minimum. I mean 3 or more. So minimum here, it means 3 or more. For example, 3 staff, 4 staff, 5 staff, 6 staff, no problem. Did you get my point?
Okay,
So
sir.
at least 1 staff for airway, 1 staff for sedation, 1 staff for cannulation, and 1 staff for reduction. Okay.
Okay,
So
sir.
if you have no more staff, at least 3. So 1 staff for airway, 1 staff for medication, cannulation, injection, and 1 staff for reduction. Okay. Here the most important also, you will keep the patient in monitored area, give oxygen, give fluids. So these very important points. And you should cover the observation for what, and also in preparation, you have to prepare the minimum equipment. Minimum equipment means ATCO2, SpO2, or pulse oximeter, monitors, and also check vital signs before and after the procedure. These important points to cover for the safety of the patient. Well done. So I will give you 9 out of 10. Well done. Perfect.
Thank you, sir.
Somodo,
Yes, sir.
okay, you will do the same station, but I will change this one. Instead of teaching, it will be practical skills only, okay? So clinical knowledge, practical skills, and communication skills, okay? And the task,
Okay.
we uh, take consent, take consent from the patient to do the procedure. And the scenario, the same scenario, but I will change your colleague, orthopedic doctor will do reduction. Your task,
Okay.
take consent from the patient to do procedural sedation. So you are not expected to do reduction, right?
Okay.
You have 30 seconds and 6 minutes.
Okay. I shall start. Good afternoon. I'm Dr. Sumudu, ED Registrar. May I know your name and age, please?
I'm Ibrahim, I'm 28.
Nice to meet you, Mr. Ibrahim. How can I help you today?
I have shoulder problem.
Oh, I'm sorry to hear that. Are you in pain right now? Are you comfortable?
The nurse give me painkiller.
Okay, good. So I'm here to actually take your consent for a procedure called sedation. I need to ask you a few questions and examine you before that. Do you mind answering them for me?
Okay.
Okay. So I understand that your shoulder joint has come out of its normal place and it needs to be moved back into its original position. And for this, it's a very painful procedure. And for this, you need to be sedated so that you're comfortable throughout the procedure. So there are several reasons, contraindications where we can't give you procedure sedation. For that, let me ask you a few questions. Do you have any allergies? Any allergies, Mr. Ibrahim?
If the actor is silent, you can proceed.
Okay. So any past medical conditions? Any medication you're on? When did you have your last meal? And what exactly happened for you to get your shoulder dislocated? Right. Okay. Thank you. So next, I want to assess your airway. I want to check from outside. And then could you please open your mouth so that I can assess your airway and see if there are any obstructions? And can you please raise your neck so that I can check the mobility of your neck? Okay, thank you very much. So looks like you have no contraindications for the procedure. So I'll take you through some of the complications that can arise during this procedure. So there are different levels of sedation we achieve with drugs, and if you go into a deep sedation, your breathing might get shallow and a little bit inadequate. To avoid that, actually, what we are going to do is we are going to prepare well. We are going to do this procedure in a very safe, monitored environment with adequate staff available. And you will be monitored, your breathing will be monitored, your oxygen level will be monitored. And if in case you develop any reduction in breathing, we are going to support your breathing. And also,